Well, welcome to the show. As the number of coronavirus cases increases, patients are likely going to overwhelm hospitals across the country. Recently, a New York medical center has given emergency room doctors authority to choose which patients can be put on ventilators and, quote, institutional backing to provide breathing tubes in cases where they deem futile.
Well, those kinds of choices are sparking a discussion about possibly rationing life-saving care. Paul Strand shows us why that's raising an ethical question.
Washington State has been one of the hardest hit areas by COVID-19, with almost 5,000 cases and close to 200 deaths. The crisis has officials and medical personnel there considering difficult decisions, according to bioethicist Charles Camosy.
Washington State actually has an approved protocol that not only is going to consider age, but also things like ability, physical ability, cognitive ability.
As the number of COVID-19 victims soars, rights groups like the Thomas More Society are warning states they could land in legal trouble if they discriminate against whole groups should rationing become necessary. Peter Breen of the Thomas More Society recently stated, "We're reading the unthinkable." The Seattle Times reported that Washington State and hospital officials have been meeting to consider how to decide who lives and dies. The horrific idea of withholding care from someone because they are elderly or disabled is untenable and represents a giant step in the devaluation of each and every human life in America. New York State has also set up guidelines which Camosy says don't consider age or disability.
And it explicitly says something that's quite true, which is this would be a violation of the civil rights of people who are older, right, and people who are disabled.
He adds states differ so much that the federal government may have to step in. And in fact, Health and Human Services just put out a bulletin to warn states not to discriminate. And its top civil rights official said persons with disabilities, with limited English skills, and older persons should not be put at the end of the line for health care during emergencies.
Unless we have a miracle drug that somehow shows up at the last minute, we're going to be rationing health care. The question is, will we preserve our humanity in the process? Will we follow the very basic values and ethical principles that we hold dear?
Paul Strand, CBN News, Northern Virginia.
Well, will we preserve our humanity in the middle of this crisis? And it's amazing how a crisis can reveal who we really are. One of the things, and it's an amazing thing that's happening, is the crisis is revealing the angels among us. Those who are willing to go into danger, those who are willing to serve, those who are willing to provide for others. We're seeing extraordinary acts of courage and of helping in the middle of this crisis. And that's fulfilling what Jesus asked us to do. And you find it in Matthew 7. It's called the Golden Rule. Do to others whatever you would like them to do to you. This is the essence of all that is taught in the law and the prophets. So what would you like someone to do if you're facing a life-threatening disease and you're down to your last breath? What would you like? If the doctor has the ability to provide you life-saving care, wouldn't you like that to be provided? So I would encourage, instead of looking at how do we triage this and how do we ration out care based on expected life expectancy or quality of life. That's a phrase I heard during my mother's stroke. What's the quality of life, as I was being encouraged to not give a do not resuscitate order. You look at these things, and these are absolutely horrific, and you go, no, we value life. We're here to preserve life. Whatever we need to do as a culture, as a nation, as a society, as community, in our hospitals, in our cities, if we need more ventilators, well, then by all means, let's get more ventilators. If we need more masks and gowns and gloves, then whatever we can do to provide that for the emergency workers who are on the front lines of this, let's do that. Please, let's not get to a point where we have to make a rationing decision. Now, in the medical community, you hear this a lot. It's called triage, and that's a French word. And the origin of it is chilling. The origin of it comes from World War I. And triage was established in the medical tents as they're dealing with the wounded coming off the battlefield. And instead of caring for the most urgent need, what they would do is they would evaluate who could actually go back into battle the soonest. And those would be the ones who would receive medical care. The ones who needed urgent care, the ones who were dying, were actually left. And that is the origin of the word. That's where it comes from. Well, we're in a tremendous battle, and we're in a battle against an unseen foe that seems to be able to replicate and spread at an alarming rate. But in that battle, let us not lose our humanity. Let us not lose what is most precious to us. And realize, let us do unto others what we would want done unto us. And if you are dying in need of a ventilator, you would absolutely want a ventilator. So whatever it is we have to do to provide that, let's do that. If we have to go into emergency production, let's do that. If we have to change the entire supply chain to provide more masks, more gowns, more gloves, whatever it takes, let's do that. Because the end, if we get into rationing in our hospitals, the end of that is not pretty. And if we lose our humanity in this, we have lost something we can never replace. So let's resolve we aren't going to do that. What we're going to do is provide for those in need. We're going to do unto others what we want done to us.